Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. So Dr. Mencia, that was a very nice thing with Haiti and all that, and we were talking about, you actually have some Haitian staff members, don't you?
We have Haitian. We are multi. With that, we have Iranian, Jewish, Haitian, Russian, Spanish, of course, Armenian, Egyptian.
That's really the world we live
Canadian.
in now.
I have a Canadian dentist. It's very multicultural.
Yeah, but
I like that.
And you have multicultural patients.
And we have American, believe it or not.
Oh, darn. I know. Well,
I'm Floridian. We have people born right here in Florida that work with us. So
okay, so I'm
going
to ask you a question because it's psychological. We don't have to talk about who you want to be the president, but what I think we have to talk about is people are very emotional in what's going on, and I know you hear this. And
yes.
Do you have advice for people to just settle down? I mean, this is getting crazy.
Yes.
Could we talk about this for this show?
We can.
I'd
absolutely,
like you to do this.
Absolutely.
Serious.
Because,
it's serious.
It is a serious situation. And for the first time, you have a person that have come from the outside to run for the presidency. But at the end of the day, we have to sit down and, we all have family. And when we cast our vote, we have to think of not only of us today, of course, we have to think of us, but also of the future. What image do we want to portray? Because when we elect Truman, Clinton, Bush, we cast our votes. We made, we are part of history. When every president that, once we turn into a voting age. And
it might not be the one that we were voting for, but it's our country and we have to get quiet. But it's more than that. The people themselves, they sit by the television, and I think emotionally it's affecting their health.
Oh, absolutely.
Am I right?
And yes, and we live in a new era. If it is true that the international power are influencing our country through the internet, imagine when you look at those polls, they can be altered. Those polls can be altered by another country, call it Russia, whatever you want to call it. But they can alter the poll and make you think that whoever is losing is close enough that only your vote can make a difference and make that person win. And if you get a lot of people to be fooled by that, so you might put the wrong person as a president because you're following. So you really have to follow your heart. You cannot go by that. Nowadays, so many things on the internet, and so many things can be manipulated through the internet. You get people on Facebook that they post the wrong name and the wrong picture. So it's a lot of fake things out there. So you have to be very cautious on what you read on the internet.
Well, let me go even further because I'm not on Twitter. I'm on Facebook, and it's like people are very hostile. And whether it's the election or something, they use Twitter to bear their emotions. And I've never had a need to do that. What is that about society, Dr. Mencia?
We are a country of marketing, and people are cashing on that. For political reason, usually we don't use marketing strategy in that way. We do, but more in a more political tone type of marketing. This is a marketing that, from what's going on from some of the candidates, that they don't care if it's good or bad. They don't care if it's foul language or not. They just care to be on the news every hours, on the hours, 24/7. because the more people hear of your product, the most likely they're going to buy it. So, we are a capitalist country. So we have to be cautious. And we are a capitalist country that, is leading the way on the internet and on technology. So we have to be very cautious that we don't eat ourselves. We need to meditate. We need to reflect on ourselves and who we are as a nation. We are not a nation of wars and separation. We are a nation of integration. Even look at the Muslims that come into this country. They become American. They become part of the mainstream society. The Jewish people that have come here, they have, a lot of the Jewish people that have come to this country, they have separated from their root, so to speak, to become Jewish American. And they are somewhat different. The Armenians that come to this country, they are not the same. The
just
Haitians,
what we were just talking about.
Right. So all of these nations that we accept into our country, they mingle with the rest of the country and they become part of, and that's who we are as a nation. We are a nation of all immigrants that have come together to create this nation, and the native Indians, they are still there. They are still walking and reproducing, so there are other nations that have killed most of the native Indians, and there's no native Indian left.
Well, they tried years ago. They tried in the early, 1600s or 70s, and unfortunately.
And the other thing, we are a very young country. When you go to Europe and I remember going to Italy and saying, this world is like 500 years old. I say, oh my God, it's older than my country. So we are a young country, we are a country still developing, and we have hope. We have hope. We cannot let people take our hope away. We cannot make a decision based on fear.
Well, let me just say, though, what I was going to share with you, that usually I come home and I fix dinner at home, and usually around 7 o'clock, Bill and I would sit down, watch television. And once you get caught up in watching the news, it's all of a sudden it's 10 o'clock, and then Bill goes to bed. Then sometimes I go to bed at 11. Do you know that I sometimes, and I'm a good sleeper, but because of the television and what's happened, I'm not sleeping well. So we've decided something different. And I have a lot of patients doing that. Yeah, I was going to ask you. I said, this is not healthy.
And I tell my patient, what I do? I watch the World Series in baseball. Something different, something entertaining, instead or I just go and rent a movie.
Yeah.
Just go and rent a movie for the night so I can watch a movie because, I work very hard and I want to come home to relax and rest. And, I'm not going to be influenced by fear to make my decision. And, you hear about all this thing about the email going on and, the last minute, the FBI is going to look into this and look into that. So, hey.
Right. And they regurgitate it over and everything. It's over.
It's the same thing.
So I think it is not healthy. In fact, some of us who don't agree with some things, we're not liking our friends now because they think a different way. I mean, I've never seen anything like this. So my advice, and I know that you're going to say the same thing, don't watch all this. You want to listen 15 minutes and then turn it off and go do something different, right?
Exactly. You see what's going on in the rest of the world. Look at, other things. What's going on with the rest of the world.
I turned off the television and got on the floor with Charlie because Charlie doesn't like you to pick him up. And he and I were on the floor wrestling and having fun. This is just really, as another thing that happened. Bill has another book that he's trying to finish. And I said to him, because let's go over your book and we can see what. And so for a couple of hours, we sat down and I read the book and he was making changes. That was a much happier evening.
Oh, absolutely.
I don't want to do this other anymore.
Absolutely. You want to see what's going on in your community. Don't get hung on in this marketing strategy
this election
that's
marketing.
Going on. It's a different election, definitely. And I think we're going to live and learn. And what I pray for, that I hope that neither party get destroyed. Because, we have had the Republican Party, the Democratic Party, the Independent Party, So, let us continue to grow in that direction instead of destroy what has been built,
Well, I think we can also learn from Brexit. Even though a lot of people didn't want it, some did. They did come together, and they're working on it together. I don't hear any outrageous things happening, are there, with the Brexit in England? I mean, they're thinking of, and that's what we should do. So whoever wins, just relax and don't go berserk. And it's funny, I don't put any stickers on my car because people are a little crazy about that.
I think sometimes when you see low income high school and junior high school, that two kids start fighting. And because I study psychology, I like to study the people around it. Are they trying to break the fights, or they are incentivizing to, to make the two go at it until one kills the other? And, I see this at the level of the presidential election, incentivizing people like, if we don't get our way, let's get out there, pull out your gun.
So wrong.
That's wrong. That is wrong. And I will never applaud such a thing. I think we are a civilized nation, and the world is watching.
Yes, the world is watching. But think about, and there are a lot of families that don't agree with one another, and so we're having hostility. And I would think the blood pressure is going to go up on this too. And I would think you're going to find people coming in there who, and I know you love to diagnose. Maybe your first question is, are you having a problem with the election?
Well, I have patients that come to me and they basically can't sleep. And they say, I can't sleep. I don't know what's wrong with me. I say, I know what's wrong with you. You're watching too much TV and you're watching the wrong thing. Most like, oh, yes, this election is driving me crazy. I say, okay, you need to turn off from it. Thank God in Florida we have early voting. So people can just go vote and you're over. You've done your part, Just go and vote and get it out of the way. And, a lot of people are going through anxiety. You get people coming asking for medication. I swear to you, I'm serious. I need Valium. I need Xanax. I'm too hyper. And I say, why don't you just take an hour or two, just go and cash your vote, and you are done with. You finish. Vote. Just get it out of the way. And
then go on your boat.
And I ask them, a lot of time I ask them, like, do you know who you want to vote for? Yeah. Do you know what? So if you know what you want, just go and do it. Just go and do it. Just don't let this thing continue to vote. No, I voted already. I did my vote already. I vote.
Yeah, I'm going to vote probably this coming week. But I'm glad we have this discussion because I see that it's taking families. They're going crazy with stuff. And I sat down and I said to myself, okay. See, Bill has because of his age, he goes through what happened. He remembered with Kennedy and Nixon. He remembered with Goldwater. So he has he said it was the same. I said, it was?
No.
Yeah, he said it was very difficult at that time, too. A lot of people.
Now you have Twitter, you have the internet.
That's the difference.
It's different.
Yeah. Now it's different.
Before you will have responsible people that will write on the candidate.
Yeah.
And will say, whatever they, the facts or what they understood were the facts. And we will read those things. Right. And we will go by what, the editorial, and we will sit down and read that. And they will present, this is what this candidate is proposing, this is what, and you will compare and say, wow, this is good for me, this is not good for my future. And you will make a decision. Now, no, you don't have that. You have what's going on through Facebook, influencing you, and Twitter. And then Twitter being put on the TV now, and taking center stage with television instead of what the editorials have to say regarding.
Dr. Mencia, but I think the people who get on Twitter, because I don't think you do Twitter, but at least I don't. No, I don't either. I think what's happened is you and I have always had a voice. I've had it on the radio, in the magazine. You've had it because of being a physician. A lot of people have never had a voice, whether it's positive, negative, and it's now a way for them to get their anger out or their ideas out. And I think that's what's happened. There's now a way for people like Facebook. It started. It was very nice, and now it's gotten a little bit more the other way. It's a way for them to have a voice, and I didn't understand that for a while, but I do now. Because if I wanted to say some stuff, we'd have it on the radio. But who are they going to tell? So now they do it like on Twitter. They spend their life. There are people that are on Twitter all the time.
All the time.
I mean, this cannot be healthy.
They can sleep.
Right?
They get up and go on Twitter.
No, it's really very, very sad. Well, I wanted to just share that this morning because, like, we had this wonderful Tanya on with WOW and the Haitian. That's important. See,
that is
those are
important
the
thing in our
important
community.
Things to do, right?
And this we have to, not neglect. We cannot neglect this thing, and the way this election is going is making people neglect themselves, their family, and their community. And
perfectly said. Exactly. We don't want to neglect what we do anymore. Let's take care of everything. And then for people who really need help, like the Haitians, let's put our hearts into that. I think we'll feel a lot better at the end of the day.
Absolutely. Absolutely. And every time I go to Haiti, they are so appreciative. I go to Haiti, Dominican Republic, Guatemala, El Salvador. One of my doctors, Dr. Pham, he go to Central America to bring his services. One of my dentists just went to Europe. I think it was an African country. He went to Northern Africa. That he went to bring his services.
This is what we should be doing. This is what should be on television, all the beautiful stories.
Right.
I've always said that. Stop with all, whether it's elections, whether other things, stop with all this negative, because I do believe it changes. I think our health has changed because, and I keep going back to that. That is not positive.
Well, I can tell you, I see in my practice, I see people, like I said, they cannot sleep, having chest pain, having
high blood pressure, I'm sure.
Anxiety, high blood pressure. And, I guess these are I have a patient just last week. And, for the Jewish religion, Saturday is very sacred. And she's on her way to the synagogue, and she said, I couldn't go. I have such a horrible chest pain. And I said, God forgive me, but I need to go and see my doctor. So she came early Saturday morning to see me. And, for a Jewish person to do that, that's serious. And she came to see me, and I checked her out, and, we spoke a little bit. And, her heart was okay, and her blood pressure is okay. I said, just... And go back to your synagogue, go and pray, just go and relax, everything is going to be okay. And then come back if you think this is continuing, we'll work you up from the cardiac point of view. And, we left it at that, and she went, and everything was fine. And usually, it's I guess these are the innocent bystanders that are getting hit by this stupidity that is going on in the media.
But I do remember... I don't remember that much, but enough about the Vietnam War. We had the same problem then. Remember, people were for it and people were against it.
Right.
And there were some pretty bad things happening at that time also.
A lot of people
remember?
got hurt.
But the thing is, we didn't have Twitter. We didn't even have Facebook. I don't even think the internet was on. So it was a matter of the radio or television. But it was very serious. They had, serious. They moved, they walked to Washington. It was... People really were hurt.
Mm-hmm. A lot of people got hurt. A lot of people were in prison, wrongfully in prison.
Yeah.
For their thoughts and
their
ideas
beliefs,
and their
exactly.
Beliefs. And, for our country to put ourselves back through that would be like going backward in history.
But it does. It is, I guess. We
want to be more civilized.
So we have to be very careful. You're absolutely right. We don't want to do that. I want to talk about Haiti for 1 minute, because I've been to Haiti, but I've been to Dominican Republic. Why does Dominican Republic in such a different world than Haiti?
Well, basically, Haiti was more influenced by France. So it's a French influence, and their language come from there. And Dominican Republic was influenced by Spain. It was influenced more by Spain. So even though they share the same island, and they've been at war with each other in the past. They had been at war. Haiti had at one point a very strong army, and they have pushed the border to one side. Almost, I think it was from what I remember from history, almost like 2/3 of the island. And then the Dominican went back and pushed them back, and for years and years they have this border that exists now, and they get along very nicely nowadays. They work with each other, and I remember when they have the mudslide and how the Dominican started, collecting and bringing stuff into. So there are more neighbors now than what the history have shown.
But now they speak Spanish in Dominican, where they speak
Creole
or
in
French, and so there's the difference.
But they in the border they speak both languages, so they do communicate with each other. And a lot of people from Haiti go to Dominican Republic to go to get their education. Uh-huh. So you get a lot of the educated Haitians that are fluent in 2 or 3 languages.
Yeah, because I know that we were talking. Dr. Leon just walked in because he's our guest at the 7:30 hour. But we were talking about Haiti this morning.
My good friend. Good morning.
Good morning.
I
Pleasure
heard
to be here.
such great things about you from a lot of other doctors. I have to tell you that we talked about a doctor that you that we just had on our radio show, and he said, "Oh, he is the best doctor for the hips, knees, and all." Anyway, we were talking about helping Haiti again. We're back to that same kind of thing. And, you think about this. We're so fortunate in this country to have doctors like you, Dr. Mencia and Dr. Leon. And I don't know what people there are doing now. I mean, the doctors, there are good doctors there, but the hospitals are in a mess. Everything's not doing well.
The main problem, I think, being there so many times, I had, brought medication, I have done things. And sometimes I have to fight with the Haitian themselves to make sure the medication get to the people that needs it, because they are opportunistic people that are going to try to intervene and try to make a living out of, the help you are bringing for other people. So we need to get a little bit more organized, because Dr. Leon can go there and do his part, and then he disappears. Then I go there and I do my part, and I disappear. But if we combine as a team, and we go as a team, I think we can bring a much bigger impact than the way we've been doing it. And to tell you, I feel ashamed as a developed country that the poorest country in the continent is right next to us, and we are doing very little about it. And if let's say Russia tried to come in and take over Haiti, then we're all going to jump in. And then we say, oh, my God, they're getting too close.
Yeah.
Or if China come in and say, we want to put a atomic bomb in Haiti, then we're going to step in and do things for that country. But that's not the right thing to do. That's a bad motivation. We should do it because, we are a nation of immigrants that have come together. And it's our duty to go ahead and help our neighbors.
I think we need to learn the lessons from the earthquake, where the populace collected so much money and it never really materialized into really helping people on the ground. And us bringing our plans in and our big developers in, our engineers in, rather than starting at the bottom and empowering people with that money, say, what can we do to help your little business, and what can we do to help your child get to the school, even though the school isn't fancy. So we have to go from the bottom up rather than the top down, even though it isn't as comforting and soothing on our egos.
Exactly.
You are so right, because I think you all know that Bill was asked to go down. We met with the Prime Minister. We did a lot of those things because he was going to build 5 little cities, and we went to all the mayors, 5 different towns, and it was all set. They were dealing with the World Bank, and then see what happened. They actually the top of the chain, I call it. They decided that they didn't. They wanted the money. They didn't want these little towns to have it, and so Bill never was able to do it. because you have all these, you have the prime minister and this one's good, that one's bad. It's just too much politics. And that never does, as you're right, never gets down to the people.
Right.
So now this group they were just here, he's not going to do that. He's going to go into the little city that they know and try to work from there. Because the hospitals, when we went down there, they're nothing. They're terrible. And of course, there were 300,000 people, as I had said before, 300,000 people who were killed in an earthquake. We talk about, all these things that happened. There were 1,000 people hurt there. There were 300,000 people that were killed in the earthquake. And when we went there, they were all intense. Nobody they didn't have light. They were being raped. It was very sad.
Right.
So you're right. It has to go down here, and then it has to go up. And I guess we've out of town.
And we have to, we have to go like education and and food. They need education. Look at Korea. We have Korea, a third world country. They're producing now their own cars. They are producing television. They're producing all this technology, and they have developed. What was our motivation? Maybe North Korea. Maybe we need South Korea to be, strong to fight North Korea. But it goes to show what Dr. Leon just said, that, we start from the bottom and we help these people develop. Let them take autonomy. And
the new person looking to be, though, the new president is a woman, a physician, actually. She was with Aristide before. And so we've met these people, and hopefully she gets to be the president. But you don't know. There's another person we just met, Mr. Moish, and he sounds great and all, but I would have more faith in this woman, frankly. So we'll see what happens.
We'll see.
But thank you, Dr. Mencia. I knew we went to a lot of topics, but I've been very emotional.
It was great. Always great.
I know about the government and what you do such a good job with that.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.